I am Aisha Khan. Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama Mariam Wacharo. You're watching the Sabah Show.
On Horizontv.
Na kwetu wanatambua kama
Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obuga. Take Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Wacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizontv. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obuga. Take Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Wacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizontv. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obuga. Take Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Wacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizontv. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obura. Tech Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Mwacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizon TV. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obura. Tech Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Mwacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizon TV. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obura. Tech Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Mwacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizon TV. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obura. Tech Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam. Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
There was no painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo. Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
There was no painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo. Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
There was no painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo. Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obura. Take Tuesday with Yusuf Farah.
800 million jobs will be lost to artificial intelligence.
Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursday with Mariam Mwacharo. Aisha Khan with thorny pertinent issues every Friday on the round table. Fresh discussions, direct probe in Sabah Show, only on Horizon TV. Wake up to exciting mornings. Healthy
Mariam Mwacharo, unatizama The Sabah Show. Assalamu alaikum wa rahmatullahi wa barakatuh, mpenzi mtazamaji wa the Premier Islamic TV station Horizon TV. Shukran sana kwa kuendelea kutegea Horizon TV. Bila shaka unajiunga nami katika kitengo cha pili cha the Sabah Show, ikiwa leo ni Healthy Thursday. Tunaangazia cervical cancer na nipo naye studioni Dr. Edward Sang kama nilivyokuwa naye last week tukizungumzia cancer in general. Today we'll be narrowing it down to cervical cancer, na tunaomba samahani na mtazamaji kwa kuweza kuanza kipindi kuchelewa kidogo. Mambo mengine unajua mwanadamu upanga na Mwenyezi Mungu akampangia, mambo mengine hayawezi kuepukika, ila tupo pamoja biidhnillahil karim, tutaweza kuangazia cervical cancer. Kumbuka mtazamaji, unaweza kuungana nasi katika social media platforms zetu at Facebook, Instagram and Twitter at Horizontv Kenya, or you can chat with me directly on my Facebook at Mariam Kasim. Before we start, let us take a look at the comment that came from Fadhili from Malindi. Anasema hali ya sekta ya afya ni kama janga la kansa ilivyo Kenya, kwa hiyo maskini anaishi kwa kudra zake Maulana. Shukran sana Fadhili kwa kuweza kutegea the Premier Islamic TV station Horizon TV, na comment yako pia endelea kuchangia katika social media platforms zetu. Mtazamaji, ukipenda unaweza kututumia arafa directly katika namba zilizoko kwenye screen yako 21951, ama utupigie simu papa hapa studioni, tutaweza kupokea tupate kujibu maswali ulionayo kuhusiana na swala zima la kansa. Daktari, karibu sana katika studio zetu.
Asante.
Last week when we were speaking, talking about cancer, we had some questions, some comments that came from some of our audience members. And before we start, I'd like to take a look at some of those questions. I remember I sent you one of them. There are a couple that actually came. If I may just take a look at some of them here. Kuna madam alikuwa anasema, na mtazamaji kumbuka, I did promise that if you had sent your questions on a line, SMS line, tutaweza kuziangazia. Na kuna bibi hapa alikuwa anasema, hakusema jina lake ni nani, lakini anasema, what is the cause of irregular bleeding or irregular periods accompanied with pain, sharp pain in the lower belly, sign of pregnancy, but eventually they fade away. Sometimes a rash in my private areas. I have one child and I have tried herbal medicine, but I've not been able to get another child. What is the cause, Daktari?
Irregular bleeding and pain, there are actually quite a number of causes. And I think she said she also had signs of pregnancy.
Yeah.
So we would want to see if there's actually a pregnancy or not. Because if there's pregnancy, it's quite important. We could be dealing with a miscarriage, an ectopic pregnancy, which can be life-threatening. There are other causes which are not related to pregnancy, are hormone disturbances, cancers, various cancers also, various medications like contraception can also cause irregularity.
Okay.
And then you may have at times two things occurring together, like ovarian cysts and causing some pain, then the periods just being irregular. Ovarian cysts can also cause irregular periods, or can even make the periods disappear. So sometimes when a lady hasn't had periods for some time, we might find that she has an ovarian cyst, which is causing that.
Okay.
Yeah.
So she also said that she has not used any family planning. So probably dadangu, the one who posted that question, kindly take some time and go to hospital to get checked. Daktari anasema they need to check if probably you could be expectant. Ama if you're not expectant, then it could be an ectopic pregnancy or some other, condition. So take time and get to hospital, upate kuangaliwa. Another question was, assalamu alaikum, Mariam wa alaikum salam. My question to the doctor is it true that cancer cells develop and grow due to acidity in the body? Does the body have a natural way of acid-base balance? Thank you, Fatma.
It's not really because of acid. And yes, the body does control the acid base balance very well, unless somebody's unwell, usually through the kidneys.
Okay.
So acidity is not really something we would say is a cause of cancer. There are many other causes of cancer.
But could it be a cause?
Generally not.
Generally not.
No.
So Fatma, acidity cannot cause cancer, and yes, the body has an acid-base balance. Mtazamaji kumbuka, you can join in our discussion on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or you can chat with me directly on my Facebook at Mariam Kasim, or you can send us a text message on the line or the numbers on your screen 21951, or call us directly in the studio on the lines on your screen. Daktari, if you can continue, let us just finish what we had started last week before we start delving into cervical cancer. So it's normal to fall ill every now and then. Everybody falls ill,
Yes.
you know, it's now raining, people have colds and everything. But for a cancer patient, how best can they differentiate? I remember last week we spoke about opportunistic infections.
Yeah.
How can they differentiate between opportunistic infections and a normal cold? Should they run to the hospital every now and then they, you know, they get some symptoms?
Okay. Usually, patients with cancer have routine, regular checkups. So initially, after treatment, it will be more frequent, like once a month. With time, it can be every 3 months, then 6 months, then once a year. Then, of course, they may get any illnesses like anybody else.
Yeah.
But what would be more concerned is if it makes them very unwell. During the routine tests, we would do blood tests to check the blood counts, just to see if there's any reduction that needs attention,
Yeah.
so that they don't get those opportunistic infections. So like if the white cell count is low, at any point, there are some medications which are given to them to raise the white cell count.
Okay.
So things like that. So they would go to hospital just like anybody else for minor illnesses. But for anything major or of concern, then we would need them to go as soon as possible.
Okay. And there's a question that has come in on my WhatsApp here. There's a lady who's saying, I've had one child, and recently I went to the hospital. I was diagnosed with cervical cancer, and I remember my mother died from cervical cancer. I have no. Okay, I do, maybe, okay, I do not understand. Khadija, if you can send me your question again on my WhatsApp the way you have, kindly send it again, because I think I do not understand some of the things that you have written. Kindly, if you would not mind, Sister Khadija. And then, Daktari, if you can continue. Let's start on cervical cancer, but before that, there's a question that came in yesterday when I was posting this particular subject. Cancer patients, when they start treatment, you know, someone has particular personality. Everybody has a different personality. But why is it that there is a behavioral change with cancer patients, especially when they begin treatment? The behavior tends to change. Why is it so?
Well, first of all, the diagnosis itself causes quite a lot of anxiety and can cause depression. Even for those ladies who come just for a routine pap smear, waiting for results can be quite distressing. So imagine now being told that you have cancer, you need chemotherapy or you need radiotherapy. There will be times when it affects you emotionally, that somebody would be depressed. Sometimes they would not even want to undergo the treatment. And so there would be those behavior changes. In rare instances where cancer can spread to the brain, then that can, of course, physically affect somebody mentally, so that their behavior can change quite a lot.
Okay. And I remember when we speak about cancer, we always have this term that comes up, remission. Daktari, what is remission?
A remission is like when the cancer is under control.
Okay.
Or there's no sign of the cancer. So if you've had chemotherapy or radiotherapy and the cancer seems to be quiet, there's no sign of it, it has settled, it's not growing, then the patient is in remission.
Oh, okay.
Then what we always are looking out for is a recurrence. So now a patient who is in remission, we should always be looking out for a recurrence, because it can come back.
But there's a chance of cure, right?
Yes.
When you're in remission.
There are certain cancers, depending on the stage, can actually be completely cured.
Okay. And is there a particular period that someone can actually have between remission and cure? Is there a period?
Okay, remission is partly that we can say is cure. And there are various things we can look at to say if this person has no chance of the cancer coming back.
Okay.
But then there are some where we always know there will be a recurrence. For example, ovarian cancer.
Yeah.
The patient, in a number of cases, after treatment, the cancer can come back and we expect that can happen after a year or two, or even a number of years.
Yeah. Okay, now let's now delve into cervical cancer. The statistics as they stand now, Daktari, very alarming. 9 people die every day because, due to cervical cancer. And that's quite frightening, to be honest. However, if we begin from the basics, a woman's reproductive system, and I can see we have a chart with us here. A woman's reproductive system is complex. We have very many things that some of us may not understand.
Yeah.
If you can just, tell us what first cervical cancer is and where it affects, the woman's reproductive system.
Okay, maybe I can show on the chart.
Yeah.
So the cervix is actually the mouth of the womb, which we can see on this picture down here. So it's part of the uterus.
Okay.
So, or the womb. So, and it's the part of the womb which is in the vagina.
Okay.
So if the doctor examines through the vagina, we can actually see the cervix and the opening, which now goes into the uterus.
Okay.
And so that's what we find here. This is a side view on this side.
Okay.
So, so some people think the cervix and the uterus are different, but it's actually the same organ, where the cervix now is the front part, or we call it the mouth, or the mouth
birth
of the
canal,
womb.
as they call it.
Yeah.
Okay. So that's the area that the cancer affects.
Exactly.
Now there's a question that came from one of our audiences, and she actually asked me, so if that's where you are affected, with cancer, what if you got pregnant first and then you were diagnosed, with cancer? Does it mean that you have to, the baby is not going to make it? Because the baby, she said, the baby lives in a bubble, inside its own bubble, and it's inside the uterus. It's not related to the cervix or anything.
Yeah.
So is the baby affected?
Yeah, good question. It's a decision which we have to make if we diagnose cancer, cervical cancer, when a lady is pregnant. There are certain stages where we have to take care of the mother rather than the baby. We have to choose.
Okay.
Because if you leave the baby to grow, the cancer is also growing. So do you want the lady to, and she could even, it would progress during the pregnancy, such that by the time she's coming to deliver, then her cancer is quite advanced. The other option we have is let the baby grow till time for delivery, then she delivers, and then we operate as we remove the uterus and the cervix at the same time.
Okay.
So that's if we find it when the lady is almost due or not too far. If it's very early and the cancer is advanced and we need to do radiotherapy, then we do radiotherapy even with the baby there. Of course, the baby is not going to survive that, but for the sake of the mother, then we do the radiotherapy.
Okay, so Khadija has sent her question here, but I'm being informed that we need to take a short break first, and then we'll be right back. I'll take your question after the break. Mtazamaji, usiende mbali, tunaangazia cervical cancer. Ukiwa na maswali, kumbuka unaweza kutupigia simu katika nambari zetu zilizoko hapa kwenye studio, kwenye screen yako hivi sasa unaangalia, ama ututumie message vile ama uweze kuzungumza nasi kwenye social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or chat with me directly on my Facebook at Mariam Kasim. See you in a short while. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
Oh, that was not painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Na mtazamaji, shukran sana kwa kuendelea kutegea Horizon TV. Unaungana nami katika kitengo cha pili cha Healthy Thursday. Tunaangazia cervical cancer. If you have any questions, do feel free to text on the line on your screen or give us a call on our studio, or you can join the discussion on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or send us a text message or chat with me directly on my Facebook at Mariam Kasim. Daktari Khadija has sent her question. Anasema, I was recently diagnosed with cervical cancer. My mom also had cervical cancer and she died from it. However, I am 5 months pregnant. Is my baby safe?
So what we need to find out is what stage of cervical cancer she has. If it is stage 1, we can wait for her to deliver, and we can actually do a cesarean section and do the surgery for the cervical cancer at the same time.
Okay.
So we might even do the CS earlier than 9 months.
Okay.
So we might do it early so that we don't give the cancer a chance to progress. If it is stage 3, then she needs immediate treatment. So that one, we can't wait for the baby to reach term.
Okay.
So we would actually start radiotherapy immediately. She would have a miscarriage, and then we continue the treatment. So because it's a balance. Of course,
Yeah.
she also has a big role to play in making the decisions. We'll give her the opinion, then she'll decide. She might say, even if it's stage 3, I don't want treatment now till my baby is born.
And she's still going to be okay?
Well, the cancer will progress.
Okay.
So because the treatment needs to be started as soon as possible. So it's only if it's very early stage that we can give time for the baby to grow.
Okay. Yeah. Yes, producer Shakombo there, I am ready right now. I know you've just spoken with me. Daktari, if I can just bring a point. Last time when we were speaking about cancer, you mentioned a word, palliative care. And I remember when we were attending a conference for the Camp Kenya Association of Medical Muslim Practitioners, of which Dr. Khadija Warfa just sent her greetings to you.
Yeah,
I met Dr. Abdurrahman, who actually also attempted, he actually explained what palliative care is. Producer Mohammed Shakombo, if you can have that clip for us play right now on palliative care with Dr. Abdurrahman.
Palliative care, it's a term which has evolved over time with different meanings, but the simplest way you can understand is a care for terminal ill patients, which is given to both patients and families of the patients. Palliative does not mean a care of a patient who is dying. Once a patient is diagnosed with cancer, you can start your palliative care, be it stage 3, stage 4. Once the diagnosis is made, it's not after the failure of treatment. No, it is the part of the treatment from the beginning of the diagnosis.
If I may ask, this kind of treatment, what is it to the family of the patient?
I would like to correlate how the human body reacts to the cancer and how the families can contribute to this. Ideally, our knowledge on the cancer cell has evolved to the current treatment regimens, such as immunotherapy. We have treatment called checkpoint inhibitors, are the most studied treatment in oncology right now with more than 600 trials, research only in lungs. So how do these drugs work? These drugs, they keep the cancer cells on check. They enhance, they boost your immunity to control the cells. So how does this help? How do I respond to your question? Is when your patient is depressed, in low motivation, low spirits, the immunity is low. So it cannot contain the cancer as when you're active and happy, psychologically set. So we urge our families, we urge our patients to be positive, to look on the positive side. They talk to their relative, they give them the motivational talk. So once they are happy and motivated, the immune system works better and it can control the cancer cells better.
That was Dr. Abdurrahman Tulkiwa Mombasa at the camp conference. He was talking about palliative care, and they were also talking about, you know, the progress that has been found in the country in terms of cancer treatment. But Daktari, if I can come to you and ask, you know, when we talk about cervical cancer, we're always told, you know, go for screening, go for screening, go for screening. And many people are usually not aware. Many of our women don't even know what this screening is. How many times should one go for screening? Maybe in a month or a week? How many times should it be, Daktari?
Actually, the guidelines at the moment, if somebody's only doing pap smear, they do it once in 3 years.
Once in 3 years. Okay.
And
that's screening for cervical cancer?
Yes, that's the pap smear.
Okay.
Now there's also something we call co-testing, meaning we do pap smear and we check the HPV DNA type. So if we do those tests combined, then the patient can actually do testing every 5 years. So that the HPV testing is available in Kenya. So if you do pap smear and the HPV at the same time, then you can wait for 5 years.
Yeah.
Because the HPV will tell us if the lady has HPV and the types which cause a high risk for cervical cancer. If the client has that, then we will screen a bit more frequently.
Okay.
But if they're negative for the HPV high risk types, then we can do the test every 5 years. But for just pap smear alone, it's every 3 years. So you don't need to test every year.
Okay. And what, in terms of cost, what are we looking at when you talk about HPV, you know, going for the pap smear rather? What cost am I looking at?
Pap smear in general in Kenya goes anything from around 500 shillings to about 2,000 to 3,000 shillings, depending on the hospital.
Okay.
So in the district hospitals, Kenyatta Hospital, it should be around 500 to 1,000.
Okay.
And then in the private, maybe about 2,000.
Okay. Yeah. So kwa kina dada zetu ambao mko huko nje, pap smear is important. It's important to go for screening, and pap smear costs between 500 or 1,000 to 2,000 or 3,000, depending on which hospital you're in. And that brings us to the point, you know, we jumped the broom. What causes cervical cancer?
The most cases are caused by a virus called the human papilloma virus. And that association was found because initially it wasn't known what is causing it.
Yeah.
So when they discovered the virus, the HPV virus, then it also helped in trying to formulate vaccination or immunization. And now the HPV vaccine is available. Of course, it has generated a lot of controversy here in Kenya.
Yeah.
But it's been in use for quite a number of years, actually. It's probably coming to 10 years around the world with quite good results, because in those ladies who've had the HPV vaccine, the rates of cervical cancer are extremely low. And so this is one of the methods that has been used to prevent cervical cancer because of the knowledge that it is caused by HPV virus.
Okay. So I remember you mentioned when you were talking about the HPV, the human papilloma virus, you said when you go for a pap smear, you have to do this other test that you check the DNA. That means there are different types of HPVs?
Exactly. Over 100 types.
Over 100 types of human papilloma.
Yes. Okay. And then there are a few which are the ones which cause the cancer.
Okay.
Especially type 16. There are given numbers. So type 16 and 18 are the most notorious. And so in fact the vaccine is for 16 and 18. So we don't vaccinate against all the other types. It's mainly 16 and 18. There is 6 and 11 which cause vulval warts, which are not cancerous, but they can be a problem. So one of the vaccines which are available also has 6 and 11 for the wards. Yeah.
Okay. And you know, as we speak about that, we did attend the presser for the camp Kenya Association of Medical Muslim Practitioners when they were talking about, you know, the HPV vaccine. And what came to our research desk is that many people have the HPV walking around with them. So what is the statistic? Maybe how many in 10 women or 10 men?
It's actually the most common sexually transmitted infection, because it's actually a sexually transmitted infection. And they say about 60 to 80% of women will have HPV at least some point in their lives. The good thing is that most women will get rid of it. The body will get rid of it.
Naturally.
Exactly. So it's like a common cold. So you'll get a cold, but you don't even need treatment. It just goes by itself. The same with the HPV. So the body clears it from the system. It's only a few ladies where the body doesn't clear it. And so that virus remains in the cervix and starts affecting the cells and makes them cancerous.
So if I schedule myself for a pap smear, what am I expecting to go through in a pap smear?
Good question. A lot of ladies come with a lot of fear and anxiety when we are planning to do a pap smear, because they hear the stories that, oh, it's very uncomfortable, it's very painful.
Is it painful?
Well, it's probably a little uncomfortable, but there are a number of ladies who, after we've done the pap smear, say, oh, I thought it was going to be much worse than that. So it's not as painful as many ladies would think.
So what happens?
So what we do, we put the lady on a couch, comfortable, relaxed, and then we use something called a speculum. A speculum is an instrument which we put into the vagina or the birth canal and then open it. Because the cervix is deep in the vagina, in the birth canal, up at the top, at the apex. So you can't see it unless you put this instrument, then you open it up so that you can now see the cervix further.
Okay, wait. So, Daktari, wait, this instrument goes in. So
then we open,
Okay, so it doesn't go all the way to the cervix?
It does, yeah. So we lubricate it very well.
So the instrument itself.
Yes, so we put it so that it slides in, and then now open very gently. And then now we use a small brush on the cervix, so we just turn it round. As it turns round, it picks cells. 5 minutes and we are done.
So it is just uncomfortable, it is not
uncomfortable.
painful?
No, not really.
So that is what we expect when you go for a pap smear. Do not be shocked and do not be surprised. It is just a simple procedure. Daktari amesema they'll only take 5 minutes and then, you know, it will be done. Daktari, are there types of cervical cancers?
Generally, there are different types when we look at what we call the histology. So if we take the biopsy and send it to the lab, they'll give us different types. But the majority of, most of them are the same. There's one main type, then there are a few others which are a bit rare. So, and that is usually the definition by the pathologists. So it doesn't make a very big difference on the treatment. There's a question that has come in here. Sister Binti is asking, I have an auntie who died from cervical cancer. I am not directly related to her. She is on. She is not my blood relation, but she is my auntie from marriage. Does that mean that my cousins could be prone to the disease, or could I get it as well? No. So it's not an inherited disease.
Also, cervical cancer is not from...
It's like malaria. You can't inherit it. You can't contract it from somebody else. It's just an individual can get it. There are some cancers which are inherited or you can occur in families, but cervical cancer is not inherited because it's mainly the virus. So each person has a chance of getting that virus.
Okay. Ahmed Osman, you're watching us from Egypt. Unasema, beautiful presentation. Thank you very much. Mariam, I like your programs. I enjoy. Say hello to Daktari. I have question. Okay, he's asking the same question about the genetic transfer of cervical cancer. Ahmed and Binti, you cannot get cervical cancer if your family member had it. It is not transferred genetically. What are the risk factors for cervical cancer, Daktari?
So the risk factors usually are, because it's a sexually transmitted infection, are related to sexual intercourse. For example, starting intercourse at a young age, multiple partners, also those who have many children and probably related in that way. HIV, those who have HIV have a higher risk of cervical cancer, and also any other sexually transmitted infection. So a lady who has gonorrhea, chlamydia, has a slightly higher risk of getting the cervical cancer.
Okay, so we know here in Kenya the age to which sexual activity is allowed is after 18, but we know that that does not happen, especially just in terms of behavioral change. Rather, this is where I'm coming to. In today's society, and this is sad to say, but we do have cases of molestation, rape, and such like. So for the young girls who have been defiled or molested or raped, rather, what steps should they take? Are they exposed to contracting cervical cancer?
Yes. So usually for rape, there's a procedure at every hospital, and of the tests which need to be done and the medications which need to be given. So depending on the age of the victim, so that will differ from one place to another.
Okay.
But cervical cancer probably would be something that we would need to look out for.
Okay. Okay. And if we talk about that, does that mean if we change our behaviors, say there are children who are sexually active at a very young age, so if behavioral change happens in society, will cancer cases reduce in young ones?
Yeah, definitely. It's a bit like HIV, where behavior change was a big part of the prevention. And then, of course, now we are starting this vaccine at 10 years of age.
Okay.
There'll be those questions about, are you now encouraging the young girls to be sexually active early?
Yes.
And there'll be all those questions. But I remember a colleague of mine who the other day said that her mother died of cervical cancer. And beyond the morality and everything, if she were given a chance, she would have wanted her mother to get the vaccine and not die of cervical cancer. And we have many patients who are completely unwell, dying because of cervical cancer. If you ask them, I'm sure they would say, I wish I had got the vaccine.
Yeah.
So maybe for somebody who's healthy and well, you might start saying, oh, this vaccine is not good, it does this or that. But for somebody who's affected, then you would see the benefit.
Yeah. Okay, yeah, that is also important to mention, Tazamaji. We're going to take a look at the HPV vaccine and all the controversy that is surrounding it, inshallah, in our next episodes when we confirm them. As we come to the end of the show, Daktari, a very quick question here. What kind of symptoms can someone get when they have cervical cancer? I know last week we said that, when you develop symptoms, then it's late.
Exactly.
But what are these?
Yes. So one of the common ones is bleeding after intercourse.
Okay.
So if a lady comes and says, I've been bleeding every time I have intercourse, then that would raise a red flag. Would really want to check. Irregular bleeding. So if somebody's period suddenly starts being frequent, they're spotting all the time, then a foul-smelling discharge. So a lady starts saying, I've got a discharge and it's really smelling, and it's watery, sometimes blood-stained, and it's really smelly. Then again, we would need to check. Then in advanced cases, then it can cause pain. It can cause kidney failure because the cancer now blocks the ureters, which brings urine from the kidney to the bladder. So that's usually a late symptom.
Okay. There's a lady here on Facebook, Akani Adejoke. She says she greets first in Yoruba and then she asks, I have my husband now for 6 years. We have not had a child, but recently I have noticed every time we engage in intercourse, I have pain and I have brown discharge that I cannot explain where it comes from, and it is not from ovulation. I know the discharge may change sometimes when you are ovulating from white to brown, but this is not it. It is not my time, and it has been happening for 1 month. Could it be cervical cancer?
Unlikely, but of course she would need to be checked. Apart from the discharge, she also needs to be checked why she has not been able to conceive, and then there are options on how to try and help her get pregnant.
And what about the pain during intercourse that she's experiencing?
We would need to check that also. There are many other causes. Actually, that is usually not a symptom of cervical cancer.
Okay.
There are many other things that can cause that.
Okay, so Akani Adejoke, you don't have to be so much worried. Just go to the hospital, get checked, and you'll be able to be advised. It is not necessarily a symptom of cervical cancer when you experience pain during intercourse or the discharge that you have, the brown discharge. Daktari amesema it's bleeding during intercourse. That could be a symptom. So Daktari, I know we are not done with cervical cancer and we're bound by time. But if you can give, just a short parting shot as we wrap up, and we may continue maybe next week on this particular subject.
Well, I think the main thing we need to do now as Kenyans is to educate people. There are many people walking in Nairobi or any other town or village who has never heard of cervical cancer. They've never heard of pap smear. So some of those ladies will get cervical cancer and not even know what kind of disease they have got. And they've never heard about it. So we need to tell them about it through programs like this, and then encourage them to go for screening and encourage them to take their girls for vaccination.
Okay. Yeah, so hizo ndio parting shots za daktari, and advice anasema, there's a gap in knowledge. Many people don't even know that you're supposed to, you don't know what a pap smear is. So today we've taken that opportunity, and I've even asked the doctor to explain what is expected and what you're going to expect when you're going for your pap smear. Remember, you can do your pap smear once every 3 years, and it costs between 500, 1,000 to 3,000 depending on which hospital. So it is quite inexpensive, and he's also saying that, take your girls for the HPV vaccine, because he's mentioned that the people who are actually suffering from cervical cancer, when you meet them, they say, I wish I would have taken the vaccine. So, just a word of advice, seek knowledge and, take the vaccine whenever you can. I'm afraid we have to wrap up here. Inshallah, we shall continue next week on this particular same topic on cervical cancer. I know we haven't exhausted it. There's so many challenges. Daktari, thank you very much for gracing our show. Inshallah, we shall continue next week. Kwangu mimi, kutoka kwangu mtazamaji, nasema kwa heri, ila kabla hapo najua kwamba kuna baadhi ya messages huwa zinaingia hata baada ya kipindi. Mtazamaji, just send in your questions and send in your SMSs. We'll be taking a look at them in the next episode. And to my crew, from my producer Muhammad Shakombo, thank you so much kwa kuweza kufanikisha show yangu, na msaidizi wake pale Saida Abud, Isaisawa alipoanza, pamoja na timu yote, soundman pale Muhammad Otweo Children, na vile vile technical operators wetu kuanzia Su, Kasim, Hashim na Biniamini, sijawasahau Sadik kutoka kule social media, na Hemed wa IT. Shukran sana kwa kuweza kufanikisha show yetu ya leo. Kwangu mtazamaji ni maasalam. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.